hospital has evolved from what had traditionally been an acute care, taking care of the sick orientation to now today it's much more health-oriented and wellness-oriented.
Excellence every day. That's the evangelical way. Caring a little more for you. Reaching out with the right attitude.
The Evangelical Provider Network is made up of the hospital and the medical staff itself. The medical staff has a broad spectrum of specialties that are not found in the traditional community setting. We try to put care into what we do because the patients that we take care of and the visitors and relatives that come with the patients are the same people we see in the ball fields after school or in the grocery stores, or there are neighbors that we see in church on weekends. We take great pride in what we do. We want to make sure that we provide the best that we can and make sure we do it with a caring attitude and a caring spirit.
Tell me what happened.
I was outside playing basketball and I came down on my left foot and my knee slid out.
Did you hear a pop or a crack?
Yeah, snap.
Can you show me where it hurts?
Right on the outside, right in there.
Does it hurt here?
Up there it does.
Does it hurt over your kneecap?
Yeah.
Okay. What we're going to do is get an x-ray of your knee to see if anything's broken, and then we'll determine at that time how to manage this.
When a doctor orders an x-ray, he is ordering it to have the integrity of that image done.
Excellence every day.
If the radiologist feels it's necessary to take it any further after consulting with an ER doctor, you can have a duplex scan done, you can have a CT done, or you can have an MR done. Our techs are registered, they are courteous, they are kind, and they have empathy towards the patients.
Here at the subacute unit, it's really a nice environment we have set up here. We work very closely together with physical therapy, and the OTs work together as a team. And working together, it's really easy to accomplish what the patient's goals are and what the therapist's goals is to get this person back to their environment.
Ultimately, here at Evangelical Subacute Unit, we want the resident to feel comfortable, to feel as though this is their home away from home, a place where they can bring their family, their friends, and recuperate and recover in the most comfortable fashion possible.
And it's really unique because the physical therapist will work with the strengthening and the endurance and the balance and working with the gait patterns and getting them to ambulate. And then the occupational therapist will take it a step further and will work on them performing a functional activity, and this functional activity can include dressing, bathing, grooming, working in the kitchen. By having the patient do these activities, it's actually giving them self-confidence to go home and perform this. And so they're performing it here, and so when they leave here, they say, you know, I can do this, I can go home.
Excellence every day.
Evangelical hospice is very important to the community because it allows a patient to be in his home with his care being provided by his family. We work as a team. Our physicians, we have 2 medical directors on that team. We have a pharmacist. We have our chaplain, our nutritionist, our social worker, our aides, and our hospice volunteer coordinator. So it's a real holistic type of care. We care for the patient as far as his medical symptoms are concerned, but we also care for him emotionally, socially, psychologically, and we include the family and all those entities as well.
Excellence every day. That's the evangelical way.
She has a displaced fracture off the inside part of the femur bone. Now what that means is that there's been a detachment between the condyle, which is the distal part of the bone, and the majority of the femur. We can repair this. I'd like to put the arthroscope inside the knee, look underneath the kneecap and look at the area that's been damaged, repair it, and then she'll be home before you know it.
Okay.
I'm Sandy Nelson. I'm the director of Evangelical Hospital's Home Health Services, and we provide health care primarily to patients in their homes. One of our programs is our cardiac care program, and it's really a supplement to the rest of the cardiac services here at the hospital. Education is a big part of what we do. The nurses may teach a patient how to take care of their diabetes, how to follow the correct diet and exercise program. Our goal is to help patients to become self-sufficient and to be able to manage on their own in their home as long as they possibly can.
Excellence every day.
The Pediatrics unit at Evangelical Community Hospital was designed with our children in mind. The staff are pediatric nurses who have been educated to take care of pediatric patients. That is important with their drug doses for pre-op medication. It's important for the recovery from anesthesia, which is very different than the adult patient. Our one-day surgical unit gets consistent high grades in the 90th percentile on our patient satisfaction surveys for all members of the team and the environment down in the one-day surgical unit. When we talk about all members of the team, there's certainly very different nursing levels, RNs, LPNs, nursing assistants, unit secretaries, but also the transporting staff. The anesthesia staff is very key. We do have staff members from the ancillary departments, radiology and the lab and respiratory therapy that interface. And all the folks that work to provide care to the patient obviously do an excellent job because our patients give us very high ratings.
Excellence every day. That's the Evangelical way.
I've been the medical director of the Spine Center since 1989. One of the things that we pride ourselves in at the Spine Center is the mix that we have. We have a mix of high-tech equipment. We have numerous treadmills, all sorts of aerobic exercise equipment, and state-of-the-art Nautilus-type equipment. The staff also is extremely well trained, and it's a growing department. Every year we're adding staff to the department. With the Spine Fitness Center, what we try and do with these patients is have a sports medicine approach to rehabbing the spine-injured patient. We try and encourage them to recover by taking a more active role in their recovery. And it allows us to give a really close, hands-on approach to the treatment of the spine-injured patient.
The Evangelical Community Hospital provides athletic training and services to a variety of the schools in and around the area. In doing so, we provide emergency on-site care to the athletes during games and practices.
I'm Andrew Ettinger, one of the family physicians out at Meadowgreen Medical Group in Mifflinburg. I work with the Evangelical Medical Services Foundation. The foundation offers a variety of different outreach clinics within the communities to provide convenience for those patients living in those areas. One of the things we do here at Meadowgreen as part of an outreach clinic is coordinate services with specialty physicians. We will take care of all referral forms. People can come here to get their pre-op blood work or other testing that needs to be done, such as EKGs done before they would get their surgery. Those can be done here in the outreach clinic so that people don't have to travel to the hospital for those services.
Excellence every day.
The Community Health Education Department at Evangelical Community Hospital takes the health of our community to heart by offering several programs throughout the year for all ages. For new families, we offer car seat safety installation checks, in which we go out into the community and check for proper installation of the car seat. We have the smoking cessation class, monthly CPR classes, and the flu vaccination clinics. Our senior population enjoys coming to our support groups, attending the Senior Lifestyles Fair, and taking part in the 55 Alive driving classes. Our most popular course is our Lamaze classes for our new families.
And I do this for the whole contraction, and then the contraction ends. And I rest and relax until the next contraction starts. Get the idea of how it works?
Good, good. Keep breathing.
We firmly believe that labors and deliveries should be a family experience. And that's why we've named the obstetrical unit here at the hospital the Family Place. I'm Dr. Russell Stankwitz of OB/GYN Associates of Lewisburg. I'm in practice with Kay Zalaki and with Dr. Fred Teichman and Julie Redkay.
I really enjoy the newborns, and it's really exciting. I can't really think of anything else I would rather do in my life than to be part of this family's experience of bringing new life into the world.
The specific experience that we have with Kelly, Kelly had a pretty normal and uneventful pregnancy. We developed a problem that occurred during your early stages for labor, where we found that the baby was experiencing some stress.
When her water broke, there was meconium staining in the fluid, and that's always a concern. And at that point, I did not hesitate to call Dr. Stankiewicz, who came immediately and agreed with my findings.
And there were some telltale signs that told us that we needed to expedite her delivery. We proceeded with a cesarean section.
Look what I have here. Here's your little guy. Look at him, Cal. Congratulations, Ed. Thank you, Doctor. Thank you.
Excellence every day. That's the evangelical way. Caring a little more for you. Reaching out with the right attitude. Living the life you meant to live. Giving it all you got to give. Excellence every day. That's the evangelical way. Excellence every day. That's the evangelical way.